Thank you for joining us today for our 2024 Insights Report and Fireside Chat with Dr. Paul Desant. Relationships Matter, a conversation about mental health and well-being. For this year's Insight Report, we chose to focus on relationships because as we continue to mine the deepening concerns regarding burnout, we're finding ways to support how we can mitigate and recover and illuminate a path forward towards human flourishing. And we kept coming back to the importance and the need for developing and cultivating relationships. With intense and troubling challenges facing healthcare, it is critical we address needs and the humanness of healthcare professionals. In 2024, we'll continue to live through the fingerprints of the pandemic and the strain it has had on connections with self, family, and community. A new normal for work and life have been forged, and it's critical that we address what's most important to the incredible people who provide care. What we know is addressing burnout requires a whole person, needs-based approach and create the fertile ground for the web of connections that foster ways for healthcare professionals to flourish. Thank you again for joining us. Since 2007, Vital WorkLife is focused on addressing the specific challenges encountered by healthcare professionals. Our passion lies in helping physicians become their best selves. The essence of our whole person approach is bolstered by a peer-based methodology, fostering a profound trust with those who are immersed in the healthcare field. Our commitment is driven by the belief that the well-being of healthcare professionals is essential for the betterment of the healthcare landscape. As we were assessing burnout, we recognized that a common theme in putting people on a pathway towards flourishing was understanding what can be done to combat feelings of isolation, overwhelming loss of family time, and disconnection and disenfranchisement from work and community. Burnout that existed pre-pandemic hasn't gotten any better, and this duress makes it feel like we're cycling fear of a breaking point, including growing concerns regarding physicians and other healthcare professionals leaving the workforce or even choosing the field to begin with. We asked ourselves, what do we see as the most important pathway that could lead us away from the mounting stress? And that is why we positioned our Insights Report to reflect the significant opportunity to shift towards human flourishing as an antidote to burnout. This includes relationships with ourselves and our loved ones, our relationship with work and career, and our relationship with systems and community. Critical aspect of our understanding of the physician experience is twofold. First, physicians feel like no one understands what they are going through. And two, their daily stress is overwhelming. This balancing act takes a massive toll and leads to feelings of inadequacy and apathy. More importantly, we find that even when career and professional achievements are progressing, maintaining connections with friends and family is still a challenge. And long hours already present career stress. That adds a new layer of guilt formed by what is called feeling less than in our lives. Female physicians often face family challenges more than males. We find that burnout rates for women are higher, 68% to 54%, due to women facing more family challenges. This gender shift requires healthcare leaders to support female physicians' well-being and satisfaction, because we also see women entering the physician workforce in greater rates than males. It also denotes the importance of creating a stigma-free and psychologically safe workplace, including offering more impactful well-being programs, peer support, and providing appropriate mental health resources, which we will reflect on with Dr. DeChant shortly. There is light. In our Vital WorkLife peer coaching programs, we see 92% of physicians attesting that peer coaching help them remain in medicine. And this opportunity for a shared experience, cultivating trust and rekindling the power of human connection is not only important, but it is essential and a business priority and advantage. Another troubling aspect of burnout lies in what the future looks like and how anticipated shortages, what this really says about the way physicians view their work. Physicians are working more than 50 to 60 hours weekly, and EHR usage is the most prominent reason why. Every hour spent in patient care leads to about 2 hours of record keeping, resulting in more time spent away from patients and tending to their lives, while also critically impacting their sense of purpose and vocation. These increasing mounting levels of frustration, conflict, and dissatisfaction that increases the likelihood of physicians leaving the field. And system-level solutions are needed to modify EHR use and other documentation requirements, but organizations also need to focus on ways to improve work-life balance and offer diverse and varied solutions to increase opportunities to spend time on their lives outside of work. Solutions like work-life concierge services can free up time, reducing stress and allowing more time to focus on patient care and spend quality moments with loved ones. So increasing well-being solutions that can mitigate and provide important buffers to compassion fatigue are also important. Introducing these early in physicians' careers and with residents, along with care teams, including APPs, nurses, and medical assistants, we develop stronger coping mechanisms and increase resiliency as these professionals move along their career path. And where we can give time back, we're providing the best chance to enhance social and personal lives, increasing physicians and professionals' well-being and the opportunities for them to stay in the field. We also wanted to understand how physicians feel supported by their organizations. We continue to see physician burnout, disconnection, and dissatisfaction with the current healthcare system, leading to early retirement and a reluctance among medical professionals to remain in the field, as we just spoke about. Part of this is a growing sense of change on the healthcare professionals' part too. Well-being for physicians has evolved, moving from ignorance and neglect to an era of awareness and insight. There is more acceptance of the vulnerability of asking for support and for adopting self-compassion practices. That's the good news. But this is not always translating to organizations keeping pace with physicians' needs, with only 31% agreeing that their workplace supports their well-being. What we do see is that well-being solutions for all are not very effective for special groups, and the need for curated solutions aimed at physicians and healthcare providers is needed as part of your well-being choice architecture to increase the opportunity to reduce stigma and improve engagement. We also find that improving opportunities for connection, including check-ins with colleagues, resource sharing, improves peer support and reduces isolation. Modeling help seeking and providing access to peer coaching and counseling, as well as addressing system-level burnout drivers, are also ways that organization leaders can improve their physicians' well-being. And taken together, these steps can promote clinician well-being and help reduce stigma. So what does the road ahead look like? Well, well-being can't wait. Mental health needs are increasingly becoming more complex, and improving well-being is primary to individual and organizational success. Solutions that empower healthcare professionals to flourish and sustain resilience and personal well-being in a high-touch environment are imperative. We see relationships as the anchor to supporting and developing physician and healthcare professional solutions, including peer-based models. By focusing on the value of relationships to us, our friends, families, and colleagues, organizations, and communities, we can provide people with the best chances to bring their best selves to work in their lives and reducing stigma. To further explore these issues and help navigate the complexities of the healthcare and professional workforce environment, we have invited Dr. Paul Desant here to help us digest where we are today and what we can look to tomorrow. Dr. DeChant is an internationally recognized expert on clinician burnout and an advisory council member with Vital WorkLife. He advises healthcare executives on managing critical problems such as financial and staffing challenges by addressing the root causes of clinician burnout. We're really excited to discuss what you're seeing out here in the field and with your vast experience working with physicians. Welcome, Paul, and thank you for being here.
Thank you, Derek. It's great to be here, and I'm really encouraged to have this conversation where we'll be building upon that great report that Vital WorkLife produced.
Thank you so much. We're really excited to dive in on a lot of the issues, and I really want to start with a focus on relationships. What have you seen over the past year or two that represents the findings that we just talked about and that are apparent in our insights report? But most really specifically, what are you seeing about the role relationships can have to positively impact the lives of physicians and healthcare professionals?
Yeah, well, certainly most people wouldn't go into medicine if they weren't social creatures to start with. We're not all extroverts. We can be introverts, but still value that one-on-one relationship with a patient or one-on-one relationship with a colleague. And the strain of time demand is making it harder and harder to have the time for those relationships to flourish, to really work well, to deeply connect when we're constantly time pressured. So that's probably the biggest challenge. I do see change happening across the national landscape in terms of more focus on trying to do things like peer support programs or find other ways to start to help support physicians while they're feeling disconnected.
That's excellent. And one of the key areas that we were focused on and is important, and I know in your work, is that relationship with self. And we hinted at that there is somewhat of a shift, but what are key strategies or changes that physicians can take upon themselves to create that healthier balance they're seeking between their relationship with their self and also their efficiency in their practice and their work responsibilities?
Yeah, that's an interesting one. First of all, I think for most of us as physicians, we have to realize that self-care is not selfish. We go into this work because we want to be giving, we want to help others. And the work is so intense, particularly in med school and residency, that we start to feel as though if we're taking time for ourselves, we may actually not be getting enough training and skills to be great physicians once we come out the other end of our training. Um, and that's really, it's so untrue, and yet we feel this pressure to always be on, to always be learning and doing more. But we also start to realize that if we're not taking care of ourselves and we're spending that much time just on learning and developing, we aren't as effective than when we do sit down with others, whether it's with our patients or our colleagues. And only by taking care of ourselves are we then actually able to bring our full selves to those relationships when we're in them.
Yeah, that's an incredibly important point. And we talk a lot about too that in order to really provide that self-care, it's also important to understand the value of team. And you talk a lot about the impact and the importance of teams and how that can also build a lot of your own self-care practices and efficiencies. And what are some key things that we need to look at with teams?
Yeah, this one it almost seems counterintuitive. Where we, in order to have time for ourselves, the more we maximize efficiency of our time while we're working, allows us to free that time for ourselves up. And in order to maximize that time, one of the best things to do is to be present with your team throughout the day. Because so much of what's happened is we've gotten overloaded with in-basket work that sometimes gets generated by messages back and forth between the team members during the day that we don't have time to catch up on until the end of the day, and we finally get a chance to review all those. If we sit with our team members during the day, with the nurses or the MAs who actually work with us, help us room patients, help us go through managing each patient, then a lot of those things that end up in an in-basket can be handled with a quick conversation. The other thing that can happen is if we value that ability to be alone, we value private offices. There's almost this status symbol about having a private office showing I've arrived. I'm being respected as a professional. I have this private office. And yet, when we sit in the private office during the day away from our team, it actually hinders our ability to communicate with the team and adds more time at the end of the day. So sitting with our team, and particularly if you can locate that team in the same area where you can see whatever exam rooms you're working in or whatever hospital rooms you might be needing to attend to, then you're all the better able to work more efficiently with the visual cues that come from that as well. So it's this counterintuitive thing of if I work intensively with others while I'm during my day, I can then actually have more time to myself after the day's over.
Yeah, and in your book, Preventing Physician Burnout, you talk a lot about how that burnout transcends that daily discomfort. And it's really the origins are in the workplace dynamics and rather than a lot of what we feel like are our individual shortcomings. And you emphasize, as you're just talking about now, relationships in the workplace and team building and yet we still are in, understanding and trying to build those better practices. And that brings out the humanist. And you talk about shedding light on the human dimension of work a lot and how and some of the sometimes mismatches between individuals and roles and fostering strong relationships within that immediate team can really mitigate burnout in practice. And so what are some of, you've hinted at a few things that are important with teams, but in addition to like, if you're a leader too, thinking about what team dynamics can I create? What can huddles do? Or what are some other practices that I can implement? What do you feel like are the most important things that leaders and people that are really working in those team settings can do to encourage what you're just talking about, enhancing those team dynamics?
Yeah, I think the first thing is to ground your decision making as a leader about what you'll be doing with an understanding of the drivers of burnout. Maslow, I've had a great pleasure of getting to know Christina Maslach personally, who created the Maslach Burnout Inventory and a lot of the initial theoretical work on this. And while she and her partner, Michael Leiter, identified these three key dimensions of burnout: exhaustion, cynicism, and a sense of inefficacy, they also identified 6 drivers, which they linked to those dimensions. So work overload is linked to exhaustion, and that's not a big surprise. Everybody thinks that's really what burnout is. I'm overloaded and I'm exhausted. But in fact, there are 5 other drivers of burnout that include a lack of control, insufficient recognition and reward, breakdown of community, as we're talking about, absence of fairness, and conflicting values. And those 5 actually drive cynicism and have all to do with your behavior as a leader. Whether you're leading a team as small as 2 or 3 people in your office, or as large as a health system with 20 to 30,000 employees, if you can pay attention to those 5 key drivers of cynicism: control, rewards, community, fairness, and values, you can go such a long way towards transforming the culture of your organization.
Yeah, it's really important that we understand and continue to grow with our teams. And I know you talk to a lot about recognition and preparing for the day and making sure that there's just some key things that are part of what happens in those huddle moments. So in addition to that, and maybe some other practices, also a lot of what happens within the organization is across that kind of like the middle layer of leadership. So what are, in addition to what we talked about with these teams, what are some other skills that we can look at as developing with really thinking about well-being as really important as part of the culture change? And this could be from a CWO, CEO, CFO, to like middle managers. What skills can the organization be providing to cultivate that better and enhanced culture of well-being?
Yeah, great question. Yeah, I think let's start with the middle managers or even the supervisors at the frontline level. If they are running the huddles, they can build a huddle that has key components that actually address those specific drivers of burnout. A great huddle, we like to, and we've seen great success with huddles, reducing turnover, improving performance, and improving well-being. And a good huddle starts with recognition for something someone did the day before that made a difference for someone else. Just being thanked for that. These happen all day long, but rarely do we get thanked for them. Next is balancing capacity and demand, taking a look at the schedule or the census versus the capacity we've got with staffing, with equipment and supplies. Quite often we don't have the capacity to meet the demand, but if we don't, we can build contingency plans at the start of the day to be able to handle that better. And even in terms of caring for others, if somebody's got a special need that day, somebody's child is sick, or there's a special meeting they need to go to, if the team knows about this ahead of time, can rally around and make a difference. Next, we want to connect those values to the work we do. And this is using the metrics or targets. You know, every health system has a dashboard of different things we're trying to achieve around safety, quality, patient satisfaction, financial performance, access, employee well-being. When we look at those metrics that are at the outcome metrics at the system level, we realize those are a result of driver metrics that are happening at the front line level. And if we're tracking key drivers that we're committed to at the front lines to start to make a difference, we know, are we on track or not? If we are, great. If we're not, then we move into a problem-solving component of the huddle. And that's really the last component, either solving problems to help us get those metrics back on track, or solving problems that are little things that came up during the day that might drive you crazy. You open a drawer, what you need's not there. You go to get paper off the printer and the printer's out of paper. Any number of things that happen. And those, while they're so frustrating, they're also kind of little. You're not going to shut the clinic down to address them. But if you put a note on the huddle board for the next day, the team can look at that together and say, you know what, we're all dealing with that. Let's put a small team together and work on a solution. So this approach to huddles really helps address key factors that make a team feel like they're truly functioning as a team.
Thank you, and really appreciate those ideas about support. I kind of want to move into a little bit of a discussion about stigma here. And so obviously stigma is the most significant barrier to seeking help, but what do you see in working with physicians and healthcare systems that we can continue to help break through that stigma barrier?
Yeah, I think stigma is so important, and it starts early on. In our training, we're expected to be perfect, and we can go through some pretty unpleasant experiences while we're rounding as a medical student or a resident with attendings where they're drilling us to make sure we know every detail possible about the patient and about the condition. And when we don't, we feel this stigma like we've somehow failed. And then when we feel like we're inadequate, because maybe as that's all happening, we do start to get stressed, we do start to get burned out, we start to get depressed. The fear of acknowledging that somehow hurting our career development, our ability to either get to the position we want to get to, or even to earn the compensation we need to support our family. If we lose our job because of stigma of being considered a doctor that's not capable or not somebody we want on our team, because they may have had trouble with burnout or depression or substance dependence or other issues. And so that there's been a major movement across the country now to address stigma and to reduce that worry about it. That a lot of that work has been led by the Lorna Breen Foundation, which has done great work and has been actually working with others around the country as well on that. They've managed to pass national legislation, the Lorna Breen Heroes Provider Protection Act, which is now going through for second approval in Congress. If you want to let your Congress people know that you support this, that'd be great to send that support to them. Send that note to them and let them know. Vital WorkLife, supporting the Safe Haven program, absolutely vital in this work and really key to great success. It's a program that's just getting started around the country. There's only a few states that it's in right now, but there's no reason that every state shouldn't be participating in that. And so we do this by creating that safe space for clinicians, by changing the regulations around credentialing and licensing by a number of different ways to let people know it's okay to not be okay. In fact, nobody can be perfect all the time. Maybe we should even think about having a campaign against perfection, because that would open the door to make more of a difference.
Yeah, that definitely would. It would help humanize all of us in a way that makes it more comfortable. And I think too, as you're bringing up a lot of these system level changes too, is to move back into the system. What's really critical for leaders to look at what they could do and really champion across the organization in order to help support well-being?
I think, well, one, from a conceptual level, this is something that I came to later in my leadership career. I wish I'd learned it earlier. Most organizations with an org structure, whoever's in a lead role has people that they're responsible for, and they're usually called direct reports, and we're expected to hold them accountable to perform to a certain standard. And yet, I think that creates this tension and negativity. And if we think of the people that report up to us instead as being our direct support people, our job is to support them so they can be successful in their jobs. It turns that dynamic 180 degrees and really makes a difference. One way to help build relationships and even communicate that better is for leaders to shadow the people that they lead while those people are working, to actually see the reality of the job. As leaders, particularly as you get into higher levels of leadership roles, you get caught up in doing in all of these different meetings and committees and things. And it's very easy to slip into making decisions, sitting with the committee in a conference room, looking at spreadsheets and reports, and not really understanding the implication of the decisions that it's going to have on the people on the front lines that are running your operations, delivering the care to the patients. And by spending time shadowing, actually watching the reality of the challenge that a doctor or a nurse faces, it can open people's eyes dramatically to realize there are other things we need to be considering as we're making this decision. And it can help frontline clinicians feel that people at the top actually care about me. They're here actually seeing what's happening, feeling my pain while I'm doing this, getting that deeper understanding, building that relationship.
Yeah, and that you bring up an excellent point about modeling, and we see that across the board, that where the well-being is really modeled from the leader, kind of it can cascade really effectively down through the organization, where it's not happening at the leader level, or at any kind of you mentioned even supervisor, and within that relationship, then it makes it really hard for the direct reports to understand who cares about them. If it's not something that's generally agreed upon and expressed, that is a really important part of this big picture of what we're trying to achieve here. And we've talked a lot about several areas, and so as we kind of wrap up on our fireside chat here, what are the key things? What are the key practices that the listeners, the viewers of this can take home and start initiating right away? I know we always want to give the tools to people. We always want to give them the access to what they need. What is it that you feel like and you've seen as most successful to help them really achieve what they're looking for to improve their well-being?
Yeah. Well, first of all, that concept, self-care is not selfish. Do carve out some time for yourself, but make it on your terms, what works well for you. Secondly, in order to have that time and in order to have time for the rest of your life, improving the efficiency of your practice is key, which is not something you can do all on your own. This is teamwork. It requires resources from the top of the organization. It requires great leadership and management right immediately above that organization, that work unit. And it requires commitment from everybody in the work unit to collaborate to do this. But with changes that are happening in technology, particularly with artificial intelligence, natural language processing, we're seeing virtual scribes come into play and making an impact. We're seeing opportunities for gathering information, for preparing information for physicians, to even draft inbox messages to reduce that burden that physicians are experiencing through the EHR. All of that work will make a difference, and people embracing that, learning it, and working through it is really key. And then from leadership standpoint, it's changing the leadership dynamic, recognizing that this is not top-down command and control management. As much as there's urgent needs and organizations are struggling financially, you can't top-down command and control manage physicians. It turns into that old saying about trying to herd cats. It doesn't work. We're knowledge workers. We need autonomy to do our work, but we also need alignment. So we don't have hundreds or thousands of physicians all autonomously out doing their own thing and destroying the organization from entropy. We pull people together and align around the values that bring meaning to our work. And when we are explicit about those and see how those are applied in our daily work, then we actually can move forward collaboratively and really make a difference. This takes time. It's not something you can just walk in one day and do, but in a concerted effort and really thought through with a strategy, it's amazing what a difference it can make.
Yeah, thank you. And I'm glad that you wrapped up on talking about that tension between our needs and our cultivating relationships, which is a very human focused initiative, and balancing that with the stress of our technology, and encroachment of technology in our world, and our balance between the utility of it, but also the frustration by it and the amount of time spent figuring out how to use it effectively, but also in record keeping and all the issues that we talked about. And then also the alignment of values, which when we get through all of the details of this, it truly comes back to the values, and those need to be human focused and focused on what our most important needs are. And when we do that, we find solutions in those processes. So thank you for wrapping all of that back up today. and focusing on collaboration and relationships. We'd now like to open this up for questions from viewers, and so please use the Q&A tab at the bottom of the screen to put in questions, and we'll monitor this chat and we'll go through some questions here with Paul. Paul, thank you again. And we have a couple questions here that extend one of the, I guess several of the key messages that you were bringing up. So try to get through as many of these as we can in our time allotted, and try to spend our time wisely here, helping people. One of the key things, and this is, you brought it up kind of interestingly in focal point of having decisions made with spreadsheets all over the table, and you also talked about dashboard development. And so in the world of trying to understand how we can better monitor and measure well-being, how can we encourage, or what are some key measurables that you've seen that are really effective to bring well-being out into those dashboard and metric driven pictures, and that can help us understand how we're measuring the impacts of well-being at our workplace?
There are many different burnout surveys out there, ranging from things as simple as one question, is often referred to as the Dolan question, which is basically using my personal definition of burnout. I experience burnout, and it has 5 steps between almost never to daily and feeling a need for help. That one question actually can work very well as a pulse survey to get a sense of what's happening in the organization. Beyond that, there's multiple surveys which get into detail around different specific drivers of burnout, and multiple organizations are using these in a variety of ways. I don't think there's any one that's necessarily truly superior to the other, as much as it depends on what you're looking for and how you're going to use the data. And what follow-up happens is almost more important than the actual questions themselves. We often get asked, will people even fill out a survey? Is the survey, if it's shorter, will it be more likely people will fill it out? And in reality, the challenge is people will fill out a survey, they'll spend some time doing it, if indeed they feel some change is going to happen because they've invested that effort in it. And so the more important thing is, first of all, to have the person asking to do the survey to be that physician's direct supervisor, so that it's someone that is meaningful to you, asking you to do that survey. You're far more likely to do it. For the second round and subsequent rounds after that, the question is, what happened with that first survey? Could you see tangible change actually take place? Or was the survey done and then nothing happened? Because if nothing happens, people aren't going to continue to do the surveys. If things do happen, they'll be far more likely to be engaged.
Yeah, and we've also seen, just as an add-on to that, where we can couple the burnout element and burnout surveying with also an additional element of asking about flourishing and joy. There's an opportunity there to combine those data sets and then to really help. And I think this leads into like the next question I'd want to ask you is, how do we encourage administration to make company-wide changes for well-being? And that involves a lot of what you're measuring. You can't change or add to what you're not measuring. And so how do we move this into areas that we can really help encourage administrators and those in the decision-making roles to make these company-wide changes to improve well-being?
So the first thing, I say this often, is for leaders to go shadow clinicians working on the front lines. And this is not just walking around and asking people how it's going. It's actually following someone around, just like when we're a med student following and attending to learn how that work gets done. That's not always comfortable and easy for leaders to do, but with some forethought and some thinking and really developing the process of doing it, it can be both comfortable for the leader and very worthwhile, the follow-up that comes from that. Once that's taken place, then also just understanding the impact that burnout has, not just on the individuals that are experiencing the burnout, but across the organization. As people burn out, they're working less, so they're producing less work units, so to speak, RVUs, or other ways we measure work units. If we're performing poorly nowadays in value-based care, we may get paid less for each work unit or each covered life that we have. And as we're performing poorly and doing less work, we could be getting paid less on each unit of work that gets done less often, resulting in actual significant financial impact on the organization. So that alone should hopefully spur leaders to get engaged. Oftentimes the results are significant enough that just like doctors will deny the validity of data if we're being questioned about our quality of our care or our patient satisfaction scores, leaders may look at these and go, that can't be true. So sometimes we do have to deal with that whole question of doubting the validity of the data at first. But once a leader's truly committed to overall success of their organization, the well-being of the workforce becomes a vital component of it. They really have to be engaged.
Yeah, and I think that that ties into, there's a couple of these questions that are showing up here that are surrounded around some of the individuals, and really diving a little deeper into that burnout the burnout equation for everyone. You brought up, the question said about burnout to me and defining that. And well-being is similar to that, in that there's different ways that we can design and define what we find as well-being. But one of the key things that's really important for us to understand more is how do we educate and continue to advance the notions of well-being to providers and other staff on some of those realities of burnout. And some of that, when we talk about that, it's the symptoms which we've covered and we've talked about and they've been assessed, but also in terms of the treatment, which is part of the interventions and solution focused work, or well-being at the work site opportunities for people. But then what about resolution? Sometimes that's something that doesn't really get the attention as well. I feel like this, and how long might this last? Or what are some of the key things, or even what are some of the milestones I can look at that help me improve my well-being, or have at least help me understand that I'm on a path towards betterment, and it's just something that takes time and commitment and adjusting and iteration around for myself.
Yeah. I think with all of what you just described and asked about, it's important to start, maybe help reframe the conversation around well-being, around something positive. It's so easy for us all to get caught up in the burnout, and that becomes negative and it's harder to engage in, and it can be off-putting to people and any stakeholder involved in this. So thinking about, one of the ways I like to think about it really is physicians, we should have the best job in the world. We have patients who come to us, share with us their deepest hopes and fears that they don't tell anyone else in their lives. We do procedures that save lives and relieve suffering. We mentor young people preparing to become our colleagues. We even get to work on research and innovation to make healthcare better. We have all of these opportunities for professional fulfillment, and sometimes we lose sight of that, either because we're so overwhelmed by everything else, we're only spending a small percentage of our time on those professional and fulfilling activities, or we've just heard about all the challenges so much that we've lost focus on that. So having that aspiration, this is what we're moving towards. This is, the opportunity we have to actually achieve what we'd hoped for when we first joined the profession is really key. Then following up on that and dealing with each of the individual issues, building a framework around that aspiration can make a real difference. And the framework, I like what Stanford WellMD model has come up with personal resilience as something to focus on. That whole concept, self-care is not selfish. So there's many people offering many opportunities around that work. I don't need to go into detail on that. The second is practice efficiency. This is where we get the opportunity to actually spend more time doing that professional and fulfilling work by removing all of the other stuff. I call it administrivia. There's a big movement now called gross, get rid of stupid stuff. How do we change the workplace so that we can spend most of our time focused on what's most meaningful to us? And then the third key really is leadership. It's having leaders understand this and moving directionally, the big picture culture shift direction towards making this a priority, because it's been shown over and over again. If you have a well-engaged workforce, people who feel that there's meaning to their work and they're able to do that meaningful work most often, those are the organizations that succeed in the long run. And every organization is under so much pressure now. Anything we can do to enhance our opportunity to be successful is key.
Yeah, thank you so much, Paul. I know we have so much ground to cover, and I feel like we could spend the whole day covering exactly what you talked about. But there have been couple of questions that have come in and really talking about how does AI help or hinder burnout with physicians and PAs, and using AI to assist with notes so that you can have more time to see patients. And so what are some methods you see that are really supporting well-being for docs and PAs and other healthcare professionals in the use of AI? And what have you seen in improving well-being with that, with the use of technology?
Yeah, the most prominent thing with AI right now is the virtual scribe. There's a number of companies that have come out with these. They are demonstrating people are reducing their pajama time and able to spend more time truly focused eye to eye on their patient rather than focusing on their computer. These are all early days. There's going to be a lot of improvement. There's some need for improvement, but definitely it's worth getting engaged at this point in these opportunities. There's more than just the virtual scribe, though, in AI. When you think about everything we go through to care for a patient, when we first know we're going to see that patient, reviewing that chart, going through all the detail that might be in there that could be crucial, but it's easy to miss. And there are programs now that will forage through the chart and bring pertinent positives forward so we can quickly look at those and save tremendous time. Preparing for that visit that day, what's needed in terms of chronic disease maintenance, preventive care, or follow-up on a previous visit, pulling all that information forward, even pending orders in the chart ahead of time, so that it makes it more facile for you to care for the patient that day. Same thing with follow-ups. Big issues there, ensuring a patient's getting to the care they need, all those sorts of things. And lastly, the in-basket. It's become a huge challenge for many physicians now. The volume in in-basket messages is up 300%. I like to joke the ICD-12 is going to have a new ICD-9 code or ICD-12 code called portal hypertension for all of physicians that are overwhelmed with the portal messages that are coming in. But there are AI solutions now coming up to help reduce those messages so that you're only getting the ones that are necessary, and even drafting model messages that you can use to answer the patient, so it cuts down the time you need to develop that message. It's really across the board in so many things we do that there are these opportunities now.
And again, I want to ask more questions here, but I know we're getting close to time. And one of the key ones that I want to make sure we cover today, because I think this speaks to several aspects of relationships, but also burnout, reducing, mitigating burnout, but improving joy and flourishment is, we understand some of the key things that can happen. And peer coaching among all is one of the most successful. So given the high rates of burnout, and given what we know about that peer coaching environment, how can we improve provider engagement with coaches? What are some of the key things that systems or leaders can do, or even individuals by word of mouth and supporting each other? What can be done to improve engagement to help us improve this opportunity for people that's available to them?
Yeah, I'd say two key things. One is meeting people where they are, offering coaching at a time when the physician actually can participate in it is really key. And then really getting true value from that coaching. If that the coaches who are skilled in Vital Work Life has many skilled physician coaches. People that address the specific needs are able to listen, get down to the core challenge that you personally have, and are able to offer opportunities, solutions, direction around those. All of that's really key. A coach that comes in with a boilerplate recommendation that's the same for everybody, well, that's less likely to be helpful than people who listen intently and people who are available when the person who needs the coaching can actually access it.
Yeah, and that ties into just a last statement too. I know there's a couple kind of add-on questions to that, but how do we also get people paying attention to it? Like how do we get people paying attention to these well-being needs?
Um, I, it's change happens when you participate. When the pain of staying the same is less than the pain of change, or more than the pain of changing, then people will participate.
Good. Well, maybe we'll have to have a whole webinar on just that topic so we can help support people. I know that's one of the critical aspects is sometimes it's preaching to the choir about well-being related issues, and so it's important for us to understand how how to move the system and move people to be more involved in helping change and continue to grow these opportunities at their work sites and in their practice. So, Paul, I want to thank you again and thank all the attendees for joining. We covered quite a bit of ground, and everyone will hopefully have time to spend with the recording and the insights report, and hopefully that will help support their own well-being initiatives at the work site. And Paul, grateful for all of the information and time, and would love to spend more time with you and see what we can do about encouraging more of these opportunities to have these types of discussions, to talk about the experiences that you see. And really appreciate your time today.
Thanks.
And for all of you here too, again, thank you so much for joining us. And there's a QR code here where you can scan to be directed to us for continued questions that you have, or to learn more about the Insights Report and Vital Work-Life Services. And then we also have Paul's email and Paul's website listed here as well. So you can feel free to contact Paul for some questions. I know there were quite a few too that came in, and tried to rope some of those into some other responses to try to give everyone a chance to hear something that would be meaningful to them, but making sure that we do that and give you access to Paul for some questions that you may have. Again, thank you so much. We appreciate your time, and everyone have a wonderful day.
Thanks, everybody.